My name is Kristen Ward, ID number 3366591.
What is a radiation monitoring device called?
That is called the dosimeter or dosimeter badge.
How does it work to measure exposure to radiation?
They have a film in a light-proof envelope that measures ionizing radiation.
How do we obtain readings?
Commonly, you will send the dosimeters off to the manufacturer quarterly or semi-annually to get your readings. At our practice, we have USB drives in our dosimeters, so I actually read those every month on our computers.
When should it be worn?
Every single time you are in the x-ray room, whether you're taking the x-ray or not, if you are being exposed to the scatter radiation.
Where should it be worn when taking x-rays?
It needs to be on the collar of your gown or the thyroid protector at thyroid level on the outside of the gown.
What is the MPD for veterinary staff annually?
The MPD is 5,000 millirems per year. Okay, so this is our dosimetry report. I'll go ahead and read mine for the year. It does show over here the dates of each read, the area for deep, eye, and shallow, and then the total. So my total is at 0 for the year, so it's not enough to be registered, so I'm definitely under the maximum limit.
List and explain the 3 methods of restraint used in radiology.
So one method would be manual restraint, where you are manually restraining the patient with multiple technicians, keeping it in the position that you need for the x-rays. Another one would be chemical restraint with IV sedation or anesthesia, where you can be hands-off radiation and out of the room. The third one would be positioning aids, where you can use sandbags and tape and things like that to be a little further away from the primary beam, but not necessarily out of the room. Some positioning aids that you can use to help some hands-off radiography. We have sandbags. I have a few different types of sandbags that you can lay over extremities or under parts of the patient so they can be flat on the table. You can also use tape to tape down an extremity. You can also use like tie downs that you could put it on an extremity and pull out to the end of the table. The V trough here is also a good tool where you can put it up here, have the patient lay in the V trough so they stay in dorsal recumbency and very straight. And those will all help you to be hands off or less close to the primary beam whenever you shoot the x-ray.
Discuss physical protective barriers that can be utilized in the radiology suite other than PPE.
Some places have lead-lined walls that you can stand behind, and then there are like screens that can hang from the ceiling or that you can move around in front of you whenever the exposure is taken.
Explain how distance and the exposure time setting on the machine can be utilized as safety measures.
So ALARA, you always want to try to implement ALARA, which is as low as reasonably allowable. So you want to be away from the primary beam, so the time that you take the x-ray is exposed as low as possible and you're away from the beam.
Explain why no portion of any human, shielded or unshielded, should be exposed to primary beam.
Our PPE only protects us from scatter radiation and not primary beams. So even if you have gloves and gowns on, you should not be in the line of the view because it will not protect you.
Explain why non-essential personnel should be removed from the X-ray suite during exposures.
Same reason, you don't want to have any unnecessary personnel in the room, potentially being exposed to scatter radiation if they don't have to be, so you want to keep as less personnel in the room as you can.
Explain why we should make every effort to obtain diagnostic images on the first exposure.
You want to protect the pet from excessive radiation as well as yourself. So you want to double check your settings and your positions at least twice before exposing once.
Explain the scientific reasoning for restrictions on pregnant women and people under the age of 18.
So radiation affects growing cells and cell DNA. So pregnant women that have fetuses, it would affect the fetus more than people that aren't growing necessarily. So they say 18 years and younger, you're obviously growing as well, so radiation can affect you more and affect your DNA that's replicating. Okay, I'm going to demonstrate how to put on all of your PPE for taking radiographs. First, you want to make sure you have a gown. Make sure it's on snugly. Then you have your thyroid protector. And you want, this is our dosimeters here, it has our name on it. You want to keep that on the outside of your collar here. Then we have gloves. And then some practices will also have protective goggles that you can wear. We don't have that here, so this would be our PPE. Before taking radiographs, you always want to examine your PPE for cracks or tears. So each and every time you put your gear on, you want to examine them. And then they should also be x-rayed themselves periodically to make sure there's nothing broken down on the inside, and replaced as necessary. So all of these are in good shape and can be worn to fully protect ourselves. In this video, I'm going to be demonstrating on this stuffed cat here, a cranial caudal view of the radius and ulna. I'm not going to be actually taking the x-ray, but I'm going to explain exactly where to collimate and center on this patient. For the radius and ulna cranial caudal view, we are going to collimate just proximal to the elbow and distal to the carpus. And then we're going to center on the mid shaft of the radius and ulna. If I were to be taking this actual x-ray, we would deflect the head out of the view, use tape as a positioning aid. Obviously have all of my PPE on, the gown, gloves, thyroid protector, and the dosimeter. We're going to put our marker in here. Like I said, you're going to do proximal to the elbow and distal to the carpus, centering on the mid shaft, and then you could go ahead and take that view. You're going to take a thoracic x-ray of Arlo. We're going to go ahead and put the charge on his account, so that sends that to our x-ray computer. Alright, we'll go to our x-ray room. And over on our monitor here has Arlo's name. We're going to add a VD view of his thorax. And then that's ready. So we'll go ahead and measure him. And you want to measure at the thickest part of his thorax here. And that's usually the last rib. And he is at 17, if you'll come show this over here. So we have our little chart there. And you'll find thorax, go to 17. That is 97 kVps. .2 MAS and 300 MAs. So that is set. And we're going to try to use the sandbags as a positioning aid. All right, buddy, are you ready? I don't think so. Take towards me. Boy. Boy, man. So we are going to center on his midline and then collimate right at his thoracic inlet and then the first lumbar vertebrae. And we're going to try to get the shot on inspiration. Alright, we are taking a VD pelvis view for OFA hips on this anesthetized patient. We're going to go ahead and measure her. And she is at 11. So we have our chart here. So you find 11 there. She's going to be 73, 3, and 400. So this will 73 kVp, 3 MAS, and then 400 MAs. So that's on here, correct? It's hard to see the light. We've got our marker in there, marking her right side. And then you want to collimate down to just below her stifles and just cranial to the iliac crest. Upper body is in the trough, the V trough, so she is nice and aligned. And then you take the femurs, pull them out, rotate them internally so her patellas are in the groove. Shoot. And then we'll show the view over here. And it looks like our marker got out at the top. Yeah, perfect. All Alright, so we've marked that, and there's our x-ray. To search and find x-rays that we've taken previously, we use the IDEX Vet Connect Plus system. So you can go to any desktop in our hospital and pull up those images on the computer. So on our computer here, we open the internet, and this will bring us to the IDEX Web Packs page. Brings up our the last couple days of our x-rays. If we wanted to search for Phoenix, it's gonna pull up all the Phoenixes. And there's all of Phoenix's x-rays. Today we're taking contrast images of this little conure here. We're going to give 3 mLs of barium. Since he's so small, it's going to be a little different than dogs and cats. Then we're going to take a series of x-rays at 5 minutes, at 10 minutes, at 15 minutes, at 30 minutes, and 60 minutes. That could change a little bit, just depending on what the doctor finds on those x-rays, but usually that's pretty general for the barium studies. So we are going to order the x-rays. This is for Rico, and this is already actually on. We've already put the charge on for the radiograph, so that will send it to our x-ray computer over here.
It's really bad. I mean, she's good for the fact that she's poorly behaved.
So this is our x-ray computer. All of your options are up here. These are completed x-rays, the last 3 days, and these are the NQ. So we have Rico right here. I'm going to go ahead and select that. This is going to be adding the x-rays here. We have exotics. This is a bird. So this is turning this on for a series, so we don't have to put each individual x-ray on. Alright, so we are going to use a small amount of barium for the small bird we have here. We have 3 mLs here, and then we're going to go ahead and give this to him. So for the bird, since this guy is super small, we're just using the smallest setting on here, 1 to 5. So we have our machines up here. On the chart over there, we have our KVPs at 64, our MAS at 2.1, and our MAs at 450. So that's already set. And this is our small little column. In this x-ray, it is not possible to wear gloves whenever you do the birds. And that image, use that right there.
Okay, so we're going to label and rotate the image. Because it's in a study, you need to write when it was taken.
Hi, my name is Ashley Harvey, and I am a licensed veterinary medical technician at Village Veterinary Medical Center in Farragut, Tennessee, and I am a preceptor for Kristen Ward. Together, we've been working very hard this semester, working on perfecting her techniques in radiology. Kristen has proven herself to be very knowledgeable and is able to produce excellent quality and diagnostic radiographs for our doctors. She is using excellent technique, positioning, and collimation and is able to perform various different radiographs for both the canine and feline patient. Kristen has really put in a lot of effort this semester, and I truly believe she's mastered this skill.